In healthcare, time is everything, right? It's the one thing you just can't get more of. So today, we're going to talk about a tool that's designed to do just that, give you back your time, so you can focus less on all that admin stuff and more on what really truly matters, your patients. All right, let's dive in. So let me ask you this. Is your time actually spent on patients, or does it feel like it's spent on paperwork? I mean, if you're in the healthcare field, that question probably hits pretty close to home. It feels like a constant battle, doesn't it? On one side, you have critical face-to-face patient care. On the other, this mountain of admin tasks, compliance checks, and those never-ending email chains. It's a huge source of tension, and honestly, it leads to burnout and can really impact the quality of care.
And really, that's the heart of the problem, isn't it? Today's healthcare providers have to be two things at once: a center for amazing patient care and a super efficient business. You're judged on patient outcomes, but you're also judged on productivity. So the million-dollar question is, how do you possibly balance the bottom line while still keeping patients at the absolute center of everything you do?
Well, what if the answer is creating a kind of digital central nervous system for your whole organization? That brings us to our main topic, the healthcare intranet. So, what exactly is it? Let's take a look at how it can become the central hub for your entire practice.
Okay, so on the surface, it's basically a private, secure website just for your employees. But it's so much more than that. Think of it as a digital workspace built from the ground up for healthcare professionals. It's the one spot they can go to find literally everything they need to do their job well, whether that's collaborating with colleagues on a tricky case or just pulling up critical information in a split second. So, what's the point of all this? Well, its core purpose is to go after the biggest time wasters in your day. Just think about it for a second. All your policies in one place. Communication that actually works across different shifts. Automating all those repetitive, tedious tasks. And keeping track of compliance training without a million spreadsheets. That's the endgame here. Okay, so let's get into the specifics. How does this actually work? We're going to break down 5 key ways an intranet can take a hectic healthcare environment from, well, let's be honest, organized chaos, and transform it into a place of real clarity. All right, number 1, let's talk about smarter onboarding and training. In healthcare, you never stop learning. It's just part of the job. But let's face it, old school training sessions can be a huge disruption. This is where an intranet is a total game changer. It creates a central hub for e-learning so your staff can jump into webinars, watch tutorials, and take quizzes whenever it fits their schedule. And for the admins, oh, it's a dream. All the training records, all the compliance certifications, they're all tracked in one spot. Audits just became a whole lot less stressful.
All right, coming in at number 2 is something huge, creating a single source of truth.
I want you to imagine this. No more digging through your inbox trying to find that one email attachment with the latest treatment protocol. Sound familiar? With an intranet, that's gone. It becomes the one and only place everyone goes for the most up-to-date, accurate info. And when everyone's on the same page, you get consistent, high-quality care. It's that simple. Okay, number 3. This one's all about connecting your people.
We all know how it is in a busy clinic or hospital. Communication can get, well, messy. An intranet helps bridge those gaps. Think about having a searchable staff directory right at your fingertips, or a news feed that keeps everybody in the loop with important updates. And this isn't just about making things run smoother, it's a huge boost for employee engagement and ultimately job satisfaction.
Now for number 4, and this is a really big one, automation.
Okay, this is where you really start to see that time come back to you. By taking all those paper forms and digitizing them, I'm talking everything from vacation requests to supply orders, you just slash the amount of paperwork and administrative hassle. What does that mean? It means more time, more energy for what matters, and crucially, better access to real-time patient data to help make the best possible treatment decisions. And last but not least, our 5th key benefit, creating a powerful feedback loop. It's a known fact. A happy, motivated team provides better patient care, period. An intranet gives you the tools to actually build that kind of environment. You can run surveys to check in on staff morale, or create a central place to track and respond to patient feedback. It creates this amazing cycle of continuous improvement that benefits everyone. So that's all great in theory, right? But what does this actually look like in the real world? Let's take a peek at how a few different healthcare settings are putting intranets to work to solve their own unique problems. This is a great little breakdown because it shows just how flexible these tools can be. Take an aged care home, for example. They might use an extranet feature to keep families connected and engaged. Or a group medical practice. For them, it's all about managing on-call schedules and sharing expertise. And for a clinic with multiple locations, it's a lifeline for real-time collaboration. See? Each one is tailored to solve a very specific real-world problem.
Okay, so as we start to wrap this up, it's pretty clear what the ultimate payoff is, right? It's all about refocusing everyone's energy back onto the patient. So if your organization is thinking about heading down this road, here's a quick checklist to keep in mind.
So if you're looking into this, here are 4 things you absolutely have to consider. 1, security is number 1. It's got to be HIPAA compliant, end of story. We're talking 2-factor authentication, encryption, the whole deal. 2, it has to be simple. Clinicians are busy. They don't have time for a complicated system. 3, mobile access is a must. Your staff is always on the move and they need access on their phones. And 4, it has to play nice with the tools you already use, like Microsoft 365 or Google Workspace.
You know, at the end of the day, it all comes back to this one idea. When you centralize knowledge, when you streamline workflows, when you make communication better, you're not just buying software, you're buying time. And in the world of healthcare, there is nothing more valuable than time. So the real question I want to leave you with is this: what could you do with that extra time? How would it transform the care you provide?